Today I'd like to introduce you to Dr. Sarah Colombini Osborn. She's a board-certified veterinary dermatologist here in Houston. She's going to be talking to us today about a very common problem in dogs and cats, allergies. Dr. Osborn, how do we know if a dog or a cat has allergies?
Well, allergies in dogs and cats manifest themselves primarily on the skin, so what you'll tend to see is excessive licking, scratching, or chewing on the skin primarily, and they'll also be more susceptible to develop secondary infections on their skin and in their ears.
I see. So dogs can be allergic to all the same things people can be allergic to?
Yes, dogs and cats are both tend to have allergies, but dogs are the ones that have allergies most commonly. 80% of our allergy patients are dogs. And the four main types of allergies that we typically see in dogs are inhalant environmental allergies, food allergy, flea allergy, and contact allergies. But when it comes to environmental allergies, you have several options. You can treat the patient symptomatically with either antihistamines, steroid-containing medications, or cyclosporin. Unfortunately, with any of those options, you don't specifically identify what it is that the patient is allergic to, and they have varying degrees of success. Your other option is, if you want to determine exactly what the patient is allergic to, you have the option of either blood testing or skin testing.
Okay, and in that case, between blood testing and skin testing, which would be the preferred option?
Skin testing is certainly the gold standard, and I can show you an example of that.
That would be great.
Okay. This is Belle, and she's a 4-year-old female Plothound mix that she's actually my dog that we found while camping, and at the time she had fleas, skin and ear infections, demodectic mange, and also food allergy. And we're skin testing her today to determine if she may also have inhalant environmental allergies.
Can you tell me exactly what it is we're doing to Belle?
Yes, under a light sedative, which is very safe, we go ahead and shave a patch over the side and then do pinpricks with the 50 most common allergens to this area of the country. And that includes all of our most common tree grass and weed pollens, house dust mites, molds, insects, wool, and cats. And then we grade the reactions based on the wheal that forms, and based on all of her positive reactions, we can then formulate a vaccine that contains a small amount of everything that she was allergic to, so that we can try to desensitize her to her allergens. A positive reaction will turn into a little red wheal, and based on the size of the wheal and how red it is, that indicates how allergic she is to that specific allergen. The only thing we need to consider is 75% of dogs will have a combination of allergies. So if she happens to have flea allergy and food allergy, which she does, and we don't address those additional allergens, then she could continue to show allergy signs.
Dr. Osborn, you mentioned that Belle also has food allergies. How do you know that, and how do you treat for that?
Well, unfortunately, there's no reliable blood or skin test to diagnose whether or not they have food allergy and even identify exactly what it is they're allergic to. So our best option is to place them on a very restricted hypoallergenic diet, which just means a diet that doesn't contain any of the significant allergens that they've been exposed to previously. Hypoallergenic diets come in a variety of flavors in both canned and dry options, and they even have hypoallergenic treats. So for those pets that are used to getting treats, they can still continue to do that.
Dr. Osborn, you've given us a lot of good information today. It looks like if a dog has skin or ear problems, the best approach would be to see their veterinarian for a customized plan of diagnosis and then treatment. Thank you so much.
You're welcome.
And thank you, Belle.